I was afraid she had measles, or even though she's had immunizations, I thought, oh my gosh, what did she get?
Parents in East Texas say they're seeing fifth disease, a virus that you may not know your child has until after they're contagious and have a rash covering their cheeks. Welcome to KYTX CBS 19 10 at 10. I'm Justin Early.
And I'm Jillian Sheridan. Our top story tonight, have you ever seen a rash covering your child's cheeks that almost looks like somebody slapped them?
It is a virus called slapped cheek syndrome, or fifth disease. Some doctors are seeing more cases in East Texas.
CBS 19's Jennifer Heathcock joins us tonight in the studio. And Jennifer, this is not a new virus, but it's resurfaced lately. What is it?
Well, Justin and Jillian, fifth disease is a lot like many other viruses. There's no medication that can make it go away. It just takes time. Now, this letter was sent home to parents at a school in Tyler this week. We weren't even sure what it exactly was, so we asked doctors. Melissa Garrett was concerned the first time Hailey popped up with a red rash covering her cheeks.
She's had it twice this year, once around December, and then she had it again in February.
Garrett says the rash spread and became painful.
She itched so badly and she was so hot.
But that was after she was contagious. Dr. Holly Blanco with Trinity Clinics says they see more cases typically in the spring and fall.
It usually will start off with just kind of a fever, maybe some muscle aches, headaches, kind of fatigue, and then about a week later they'll get a rash on their face.
She says it is contagious, but it's not a huge concern.
It's pretty benign unless you know you're a pregnant woman or you have a chronic medical condition such as sickle cell disease.
She says the worst part is just the scare parents get from the rash on the face.
It looks startling to parents because their cheeks are really red and flushed, but it's benign. It's not harmful to them.
Garrett says her doctor was concerned about the number of patients he'd seen with the virus.
He said that they are seeing more episodes of fifth disease than they have in years. He said that a lot of the schools around East Texas have had an outbreak of them. And when I called the school, they said they had several kids in the first grade that had it.
A virus that will pass with time, with a rash Garrett says for parents to know will spread, but they shouldn't worry.
Don't panic.
Now that rash may last for a few days and it can spread to the body, the arms, the torso, and the legs. Justin and Jillian.
Jennifer, you know, I had this when I was a boy. In fact, my school district was shut down for a couple of days because of it. So do doctors say there's anything you can do for this virus as far as getting over it quicker?
Well, actually, Justin, Dr. Blanco says that it just takes time. Some Tylenol, maybe Motrin can help some of that go away, but it's going to have to go away on its own. Back to you.
Just startling, though, for parents to see it and not know what it is.
Absolutely. I wouldn't imagine. I wouldn't know what to do.
Right. Thanks, Jennifer. Now, according to NetHealth, fifth disease isn't a reportable virus, so there are no numbers on exactly how many people in East Texas have it.
The virus derives its name from being the fifth in a list of classic childhood skin rashes like measles and scarlet fever.